Hello everyone. Greetings to all of you from the Homoeopathic Cure. With the satisfying and a very well emerging exposure with lots of good responses in all our efforts in our startup work, now we have come up with this video making a special emphasis on the healing art and science of homeopathic remedies. So without any delay, let's start with today's topic, diarrhea. Diarrhea and dysentery are two terms that sounds totally different, but when it comes to understanding, they turn out to be similar to many of us. So let's stick to the basic difference between diarrhea and dysentery and not the pathological one. Diarrhea, loose watery bowel movements that may occur frequently with a severe urgency. So diarrhea are loose watery stools. Dysentery, a type of gastroenteritis that results in diarrhea with blood, and the blood contains mucus with tenesmus. There are many remedies which can help and cure diarrhea in different potencies. Classically evaluated case is the key for any disease one needs to cure. Though sometimes due to lack of symptom availability, which may be due to any situation, be it the lack of time due to severity of the disease, or sometimes the patient may be unconscious, or the intensity of one symptom may be so much that the other symptoms are masked by this symptom. So in these cases, one needs to have some basic idea of emergency medicines to be given to palliate the case so that the proper homeopathic case taking could be conducted after the palliation. Sometimes this medicine selected on just few symptoms turn out to be similimum and may cure the case in just one go only. So let's start with the basic emergency medicines for diarrhea. So the first medicine is Acaranthus aspergillin in 1x and 2x potency. The complaints are watery stools, involuntary, painless with vomiting, there is increased thirst, and there is retention of urine. Retention of urine is complained by the patient. The second is Alosocotrina, commonly called as Elos, in 30 potency. The complaints include involuntary stools, solid or liquid passed with flatus without the knowledge of the patient. The patient will have no knowledge. The patient fears to pass gas, and there is aggravation from drinking beer. The patient can't control and has to go to the toilet as soon as the pressure develops. As soon as the pressure develops. Next medicine is arsenic album, a very common one in homeopathy. Arsenic album, the complaints include diarrhea with unquenchable thirst, smell of food also brings vomiting, and diarrhea on account of food poisoning. Diarrhea on account of food poisoning. This medicine is Carbovec. Carbovec, the complaints are excess flatus. The next is constant oozing of moisture from rectum. Constant oozing of moisture from rectum is a very marked symptom where you prescribe Carbovec from rectum. Next is Thuja 200. The complaints are stools are passed with flatus as water from bunghole. Water from bunghole. The next medicine is Brineia. We all are very familiar with Brineia alba. There is undigested food particles, and these undigested food particles will appear like dirty water. Next is Asterias rubens. Asterias rubens, the complaints are watery, brown, gushing out in violent jet. The flatus, the stools are watery brown and they gush out in a violent jet, like a jet. Okay, the next is nux vomica, a very common medicine in homeopathy. There is diarrhea due to overeating. Overeating a very marked symptom of nux vomica, right? Or some dietetic error. Overeating is also one of the dietetic error. The next is pain in abdomen before stools. The pain is felt in abdomen, before passing the stools, and the past stools reflect undigested food particles. Next being Colosense 30. Severe abdominal cramps, jelly-like stools. When the patient complains that he or she has jelly-like stools, then this medicine clicks in our mind very fast. Then brown watery stools after eating or drinking. Next is Jatropha. Jatropha 30. Stools. Okay, this is very interesting. Stools like rice water. Have you heard of stools like rice water in some other disease? So it is cholera. So the stools are cholera-like, and these are accompanied with nausea and vomiting. There is one more thing, that is loud gurgling in the abdomen. Patient easily tells that he or she has loud gurgling in the abdomen. Okay, there are some other important remedies also, like the other medicines are pulsatilla, sulfur, podophyllum, gelsemium, and crouton tingleum. So these are some other important remedies which can be given during emergencies in diarrhea. So now next I'm going to tell you some general management. We all know ORS, oral rehydrating solution, and it must be taken without any exception. And light food like banana, brown rice, curd, etc. should be taken during diarrhea. So thank you all of you. Stay tuned to our channel for the next videos which we'll upload very soon. And I hope this video would be helpful for all of you. Thank you so much.